Jordan, I'm April. I'm a student of physical therapy. How are you doing today?
Pretty good.
Good. So what's going on with your foot?
I sprained my ankle yesterday at practice, and it's just been hurting ever since then.
Okay. On a pain scale of 0 to 10, 10 being the most pain, how would you rank your pain right now?
About a 5.
Okay. I'm going to go ahead and just measure because it does look like it's swollen, so I just want to see how it is compared to your other foot. Do you mind if I take off your shoes?
Yeah,
Okay.
that's fine.
Okay. Do you mind taking your socks off for me too?
Sure.
That's no problem. Okay, perfect. I'm just going to go ahead and measure around your ankle to compare the sides. Okay, so this one's right about 9 inches. And this one's 8 inches. So we'll say there's an inch difference in the circumference. Go ahead and write that down. Okay, and then can you just bring your toes up towards me? You want to do it. Okay, and can you bring your other foot? Okay, you definitely get more range of motion. I take a goniometer and measure the difference between the two. And then I think I'm wanting to use cold on you today. Have you ever used cold before, ice pack or anything?
Yeah, I've used an ice pack on my ankles before.
Okay, and you never had any bad reactions to it? No rashes, pain?
Nope.
Any blood in your urine?
Nope.
Okay, and I want to check your circulation sensation to make sure it's all right. Go ahead and close your eyes for me and tell me if I'm touching your right or left leg and if it's your leg or foot, okay?
Okay. Left leg, right foot, right leg, left foot.
Okay, perfect. And when you use cold, your fingers or toes never turn colors, do they?
Nope.
Okay, perfect. And then I just want to go ahead and take your blood pressure to make sure that you don't have a high blood pressure.
Okay.
Okay. Okay, your blood pressure is good. You're at normal.
Okay.
125/80. I'm going to write that down for you. Okay, and we're not doing it. There's no open wounds there. It's not over a superficial branch of a main nerve. You're not too young. You're not too old. And your sensations, well, I feel like you're together to get rheumatation. And then, so what this is going to be doing, the cold will help decrease your pain and decrease your swelling. So what it does, when you put cold to an area, it takes your blood vessels that are like this and it makes them go smaller together. So there's less fluid going to the area, so it'll take out the swelling and bring it back up, okay?
Okay.
And the cold takes away your sensation of pain because your body's focusing more on the cold than it is the pain, so that will help decrease the pain level.
Cool.
I do want to let you know, though, before we apply this, there are some things that could happen if we used it improperly. So you could have tissue damage, frostbite, it could hurt your nerves, but we're going to be really careful, and I'm going to be monitoring it so you don't have any bad effects that happen from it.
Okay.
Is it okay if we use this?
Yeah.
Okay, perfect. If you want to go ahead and just lay back down there,
Okay.
I'm going to go ahead and get what I... Okay, Jordan, so we are going to go ahead and put this ice pack on you. I'm going to end up elevating your legs, but right now I'm just going to get this set up. Actually, let me go ahead and... I'm just going to go ahead and put this under your legs. If you want to raise your legs for me so I can put them under here, put your feet up on there. Okay? You know, we could actually use another pillow. Maybe we get one more. Okay. It's just good to elevate your legs so the blood flow can go back to your heart easier. Perfect. Okay, so I'm going to put one layer around your ankle here. So let me go ahead and... I'm just going to put this towel around it so we don't have ice dripping everywhere.
Okay.
Okay. And does that feel alright?
Yep.
Okay. And that's wrapped pretty good. Feels tight enough.
Mm-hmm.
Okay, perfect. So I'm going to leave that on for, you said you've used ice before, so I'm going to leave it on for 20 minutes. I will be back in 5 minutes, though, to make sure everything's going all right. Check the skin. So I'm just going to go ahead and set this timer here for 20. Here is a bell for you, so if you need anything, just ring this, let me know. And then I'll come take it off. And then I think you should be good to go. If you have any questions?
Nope.
Okay, I'll be back in 5 minutes.
Okay.
All right, perfect. It's been 5 minutes. I'm just going to go ahead and check the area, make sure this tissue looks all right.
Okay.
And you're still feeling okay?
Mm-hmm.
And I probably should have told you too, as this goes on, you're going to feel like cold at first, then it'll be burning kind of sensation, then aching, and then it'll kind of go more numb.
Okay.
So that's just normal. Don't worry about that.
Okay.
Okay, that looks good. It is a little bit red, but that's normal. So go ahead and wrap this up, and we'll keep it on for another 15 minutes. Alright, wonderful. Go ahead and turn this off. It's been 20 minutes. And you're still feeling alright?
Yep.
Okay. Take this off for you. How would you rate your pain right now after using this?
It's probably about a 3 out of 10, so it does feel a little bit better.
Okay, so I went from a 5 to 3. I'm going to mark that down. Okay, if you want to hang your feet off the edge again, here, I'll clean up that water there.
Okay.
I'm just going to re-measure it one more time to see if we had any swelling go down.
Okay.
Okay, great. It went down by 1/4 of an inch, and that one's still the same, so we won't measure that. Okay. So, for this, cold's the best thing to use for it, and you can use it at home if you would like.
Okay.
I'm sure, have you used it at home before?
Yeah.
Okay.
Mm-hmm.
So when you take an ice pack at home, just make sure you have one layer in between your skin and it, and then check it to make sure it's not getting like too painful, and make sure you set a timer so you don't leave it on more than 20 minutes, because if you leave it on more than 20 minutes, it will, instead of like making the blood vessels get smaller, it'll make it get bigger, and that's not what you want right now, okay?
Okay.
And also when you're at home, you can elevate your foot like we did here,
Mm-hmm.
and just make sure you're giving it plenty of rest until you feel like it's getting better, and we'll have you come back in 3 days and I'll look at you again, okay?
Okay.
So when you go home, use it for 20 minutes, and then you can do 20 minutes, 10 minutes off, and then 10 minutes again, 10 minutes off, 10 minutes again. If you want to do that, you can do it about 2 or 3 times a day, whatever you feel like is needed.
Okay.
Just make sure you give at least a 10-minute break in between them.
Okay. Sounds good.
And also I want you to be doing some exercises as well. So if you just want to be doing, make sure you're keeping your range of motion, so bringing your toes up, down, moving your ankle in circles, like spelling out the ABCs.
Okay.
Any questions about any of that and what you're supposed to be doing at home?
Nope.
Okay. So I will see you again in 3 days. And then for the objective part of the soap note, I would say patient was supine with pillow under head, 3 pillows under her legs. We used a cervical ice pack, kept it on for 20 minutes. Her pain from the beginning was 5 out of 10. It decreased after treatment by 2 points to 3 out of 10. Her circumference of her left ankle was 9 inches beforehand compared to her right, which was 8 inches. It decreased afterwards by 1/4 of an inch after we used the ice pack. So it shows that this treatment did help, and we'll continue to use it in the future.